Good afternoon. Welcome to this week's edition of Keeping an Eye on the Geopolitical Ball with me, Jamie Shea, Senior Fellow at Friends of Europe. Since the COVID-19 crisis broke, we've all become familiar with new expressions in the English language. Vaccination, centre, lockdown, test and trace, social distancing, and the inevitable question when you meet somebody, have you had your jab yet? But one expression always resonates with me. It's that no one is safe until everyone is safe. And I was reminded of that this week when I heard John Nagasong, the director of the African Centre for Disease Control and Prevention, point out that so far Africa has only received 40 million COVID vaccines out of a population of 1.2 billion. This is slightly less than 1% of what it needs. And at this rate of distribution of the vaccine, the goal of the African Union to have 30% of its population vaccinated by the end of this year and 60% vaccinated by the end of next year is certainly not going to be realized. Now, so far, it's true that only, relatively speaking, 5 million Africans have become infected with COVID, and only, relatively, 131,000 have died. Africa indeed has the advantage of a young and resilient population. But the director of the African Centre for Disease Control and Prevention was pointing out that, first of all, these statistics are probably far too low when we think of the reality. For example, the city of Lagos has reported that 23% of its population of 20 million have been infected. And secondly, the longer the virus continues, the more chance that exponentially, particularly with a third wave and new variants, more Africans are going to become sick. So he was clear when he said that we are not winning the fight against the virus. So what has gone wrong? Well, the first thing is a hold up in the distribution of supplies. The Africans were hoping, like so many of us, that the Serum Institute in India would produce many of the AstraZeneca vaccines that it needed, but then the vaccine went up in India and they had to halt their production, at least for export. So first lesson is we need far more diversity of supply. The Gavi Alliance, the International Alliance for Vaccines, has stepped up to try to produce now for Africa a range of between 10 to 15 different vaccines. But the rich countries have got to release more of their supplies. It is very difficult for Africans to understand why certain Western countries insist on keeping 7 times more vaccines than they need to cover their whole population. There's some good news. The US agreed this week to release a further 80 million vaccines. The EU so far has released about 250 million. And the World Health Summit meeting in Rome in recent days came up with a resolution sponsored by the IMF and the G20 to release a further 1 billion vaccines. And the EU has pledged 1 billion euros to this effort. But these good intentions have got to be followed up quickly in both size and scale if it is to halt the spread of the virus in Africa. The second thing that's gone wrong is that the Africans have underinvested in their own health capacity. It's somewhat scandalous that a country the size of Sudan with 40 million people has only 300 ventilators. Back in 2001, the Africans signed the so-called Abuja Declaration, where they committed to spend 15% of their GDP on health, but so far only 5 countries out of 54 have done so. The Rwandan president, Paul Kagame, is leading an effort to ramp up health capacity, but you need it before the crisis breaks. You can't improvise it once you are in trouble. The third issue is that the Africans have not invested in the local production of vaccines. They have good institutes in Senegal, in South Africa, in Egypt, in Morocco or Tunisia, where they could produce their own supplies to reduce their dependency on outside imports. But for this, they badly need technical assistance and money from the Western countries to ramp up this production. In this respect, some have suggested that the big tech companies like Pfizer or AstraZeneca or Johnson & Johnson should release patents and intellectual property to allow more local production. This has become a controversial subject between the United States and the European Union, but the Africans point out that a temporary release of intellectual property related only to COVID-19 would certainly help them to ramp up local production. Finally, however, we need to recognize that notwithstanding all of the efforts to help Africa, the COVID-19 crisis has severely halted African efforts to deal with existing diseases. AIDS, which has killed 30 million people over the last 4 decades. Malaria, which kills 500,000 Africans every year, or TB. The testing of AIDS has gone down by 40% as a result of COVID disruptions. Referrals for TB down by 60%. Africans are worried that the impact of COVID-19 in the long run will be much greater than deaths from COVID itself. And therefore, the international community needs to take a wider look at the problem. Cyril Ramaphosa, the president of South Africa, has spoken of vaccine apartheid, expressing a certain frustration of Africans regarding the lack of solidarity, that 90% of all of the vaccines have been monopolized by a small number of Western countries. The lesson for Africans, unfortunately, like for everybody, is that when crises come calling, nations take care of themselves egotistically, and that therefore the long-term answer for Africa is to stand on its own feet in terms of health, as much as it needs to stand on its own feet in many other areas as well. Thank you for watching and listening today. Look forward to engaging with you again next week. Bye for now.